How to treat vaginal cysts. Women often have small, painless cysts that go away on their own, inclusion cysts. But, if you have sac-like bumps or lumps around the vagina or vulva, you may have epidermal cysts. These are usually painless, especially when they're small. Vaginal cysts can be caused by trauma, surgery, childbirth, or unknown causes. You should monitor cysts since they can become painful and irritating, especially if they become infected. Diagnosing and monitoring the cyst. Consider what kind of cyst you have. Most vaginal cysts are called inclusion cysts. These small, painless cysts usually go unnoticed and clear up on their own. If you have cysts that you can see on either side of your vaginal opening, these may be Bartholin's gland cysts. Normally, the glands secrete fluids that lubricate the vaginal lips and opening. But, these can become blocked, creating fluid-filled cysts. Gartner's duct cysts, these form during fetal development and they should disappear after birth. If cysts develop later in life, an MRI is usually needed to diagnose them, too. Müllerian cysts, these develop from fetal structures that should disappear after birth, but often don't. These cysts are filled with mucus and can develop anywhere inside the vaginal walls. Watch for signs of an infection. While most cysts won't cause any discomfort, you may notice signs that the cyst has become infected. It's important to pay attention to these symptoms so you can get immediate medical attention. Signs of infection include a lump near the vaginal opening that is tender or painful, redness and swelling around the lump, discomfort when walking or sitting, painful intercourse, fever. Know when to see your doctor. You should call your doctor or gynecologist if you have any symptoms of infection or if the cyst becomes painful. A normal bacterial infection or sexually transmitted infection can make the cysts uncomfortable. These require medical treatment. You should also let your doctor know if you have recurrent cysts, even if home treatments work. Recurrent cysts might need to be surgically treated. If you're over 40 years old and have Bartholin gland cysts, you need to have the cyst removed. Your doctor will probably want to have it tested for cancer, though this is extremely rare in a Bartholin gland. 4. Follow your doctor's treatment recommendation. In addition to testing the cyst for cancer, your doctor may want to treat infected cysts. Treatment can involve draining the Bartholin cyst by making an incision, then keeping it open with sutures or packing, which will be removed after a few days. A tube may also be used to drain the cyst. Your doctor may want to surgically remove a cyst if it returns, is large, or is painful. Remember that most vaginal cysts don't need treatment. Instead, they can reabsorb on their own. If they don't resolve on their own, these cysts remain small and painless. Get regular gynecological exams. If you have a cyst removed, you should have the area checked periodically to see if the cyst returns. It's a good idea to be in the habit of getting regular gynecological exams anyway. These can catch cervical cysts and cancer early. The American College of Physicians recommends that women of average risk for cervical cancer get Pap smears and exams according to this new schedule. Ages 21 to 29, once every 3 years. Ages 30 to 65, once every 3 years, or an HPV and Pap smear every 5 years. Over age 65, none are needed if recent tests come back normal.